You know, there's been a lot of discussion, obviously, during this provincial election campaign over health care. In fact, when this whole thing started, we thought there'd be a lot more time and effort devoted to talking about health care. And lately, not so much. Immigration has taken over. And, of course, the language issue has come up yet again, or at least the issue of separation recently. Reading my email the other day, and I see a note from Dr. Paul SABA, who we have had on the show before. He is a Montreal family doctor. He's also president of the Council of Physicians. Kind of laying out, Dr. SABA, a lot of suggestions here as to what can and should be done and some of the things that haven't been done as far as healthcare is concerned. So I thought I'd like to hear, and I'm sure a lot of other people would as well, some of what you think needs to change. Because as we all know, first of all, on the issue of family doctors, nothing really has changed. In fact, some might argue the situation has actually gotten worse. So thank you for being here. And let's begin with why you felt this was necessary.
I think, first of all, Aaron, I just see, like you said, that this discussion has gotten derailed. The government says, well, you know, if you need a timely appointment with a pharmacist or a nurse or whoever, you can call and we'll get you an appointment. So they kind of try to sidetrack it. Whereas, in fact, that's not a solution because, you know, getting a prescription for a urinary tract infection will not do a screening test if you have cancer or heart disease. It won't take care of, you know, if you're having a chest pain that's undiagnosed. You know, and you end up going to the hospital where you could have gone to your family doctor. I sent out a guide to all the leaders of the political parties and to the newspapers, and I'm glad you picked it up because we know from studies that it costs 5 to 10 times more to go to the emergency room than the government actually the cost that they would if the person went to the physician's office. And you increase people's survival rates. People are hospitalized less and need less medications. And I showed some studies, in both at Stanford and Harvard, where when just by increasing the number of physicians per 100,000 population, 10 doctors, you significantly reduce death from heart attacks, from cancer, from respiratory problems. You increase people's survival in one study from almost 1 to 2 years. These are real statistics. We know there's a problem, but it's solvable, and we can solve the problem. And that's what I laid out in the press release that I sent you.
Well, okay, so let me go back a little bit, Paul, because part of what the problem is a government that talked about changing things, making things better, but has not managed to do that. And when that gets brought up, a lot of the shift says, well, you know, we had a pandemic. Do you buy that?
No. The pandemic showed how fragile the system was. You know, when they're starting putting directives in saying, you know what, we may not admit you to the intensive care because you're too sick or you're too old, because they were going to give you a score system. I mean, this is not the way you solve health care. You know, we've been living with very little margin for many years. There's no capacity in the system, and the government has not given capacity to the system. I've sat as the president of the Council of Physicians with She Hospital many years, and telling the administrators, you've got to go back to the government saying you need more money. You can't be cutting hospital beds. This is before there was a shortage, obvious shortage of nurses. All of this did was exaggerate what was going on. So we have to build capacity. And that's what I talked about in, we got to train more doctors, we got to train more nurses, and we need to train more respiratory therapists and people right across in healthcare. I came up with a model that we could do, because right now we graduate a little under 1,000 doctors a year in the Quebec medical schools, and we need to increase that number. Instead of 1,000, with 969, but we'll round it up to 1,000. We need to go up to an additional 400 trainees per year in the medical schools, applicants, and in about 7 years, because it takes about 7 years to train the cohorts. From time of undergrad to medical, once they get into medical school to the time that they graduate, it's actually 6 years after they get in. They could be doctors, and we need to have, because there's 1.5 million people without a doctor. We need at least, and the doctors aren't taking 1,500 patients each. They're taking 700. It's not because they're lazy, but they're covering emergency rooms, they're covering nursing homes, they're covering the ICUs, everything across. So it'll take an additional 2,100 exactly to cover the present need. And then we have about 150 doctors retiring a year. So to make that up, that's what I came up with, the 400 new trainees or inscriptions in medical school, because we have many qualified people that aren't getting into medical school and should be graduating from our medical schools. And we're taking people from abroad. We're not increasing the numbers. Why they're taking people from abroad? Because they get higher fees from people coming from abroad. But that's not the solution. We need to train locally, and so that people can take care of our local population.
All right. So, I mean, I'm sure people listening think, well, this makes a lot of sense. You're someone in the system. You've obviously thought this out. You have other studies that you point to that show that these things work. Why, maybe it's not a fair question to ask. I mean, why has the government ignored this? And why are they not? And first of all, we're 3 weeks or whatever into this campaign. This is the first time hearing of it. Has the government been in contact with the Council of Physicians asking for suggestions?
Well, what I did get accusé de reception. I actually got personalized. It was more than from the leaders of the political parties. Thank you, Dr. SABA, for giving us these solutions. We'll pass it on. Hopefully it'll be more than just being passed on. I know that Madame Anglade mentioned it during the debate yesterday. I was glad to hear that. Brought it up. It's important. It's got to be nonpartisan. It's got to be right across, because it's really the health care for everybody, for all of our neighbors. I believe in the Good Samaritan model, that we care for everybody, no matter what the cost. And that's what we need to do. And we need to not just, I think they probably avoid it because nobody wants to admit that that there are problems, because when you raise that up, it admits that there's a problem and hasn't been resolved. But we can, and we need to resolve that, and we can provide everybody a family doctor. It's not an impossibility. In the short term, because I did say it takes 7 years, short term, we can incentivize the family doctors who are there to take on more patients. That means increasing the bonuses. And people say, well, doctors make a lot of money. Yes, doctors do well. But if you want to get get through this problem and save lives, give them tax credits. Doctors who are retired, who don't want to go back into practice and take on patients, they can become teachers, professors. We have many, many ways of solving it in the short term and also in the long term. Some people say, what about foreign graduates? I'm not opposed to foreign graduates, but it takes a long time to get them trained, because you just can't throw them out there. So in the meantime, let's allow people who want to go to medical school, because we have great medical schools. We have next to the best in the world. Why don't we just bring more into medical school, give more applicants? I said about 400 who are going to be per year. So increase, like I said, our classes from a little under 1,000 to about 1,400 in 6 years. The first group will come out. In the meantime, we'll have people up and running in no time, in 7 years. Short term, long term, we can solve the problem.
Two questions really quickly before we run out of time. Number one, money. How much more would it take? Where are we going to get it from, if it would in fact take more? And number
right
two,
now, I agree. The budgets are strained. But the federal government, and presently Trudeau's in power with the Liberals and the NDP are together, they should make that a priority. We need to train, educate more doctors and nurses, give more money for health care and education. Health care right now, the federal government is giving around 22 cents per dollar. We need to go up to 35 cents. When Medicare first came into being, it was 50 cents, the federal government contribution. So the federal government needs to kick in more so that we can pay the doctors, nurses, respiratory therapists, and other healthcare workers, and also train more and give more so that they can put more into the educational system.
Okay, I was going to ask you about what you think about the CAC's idea for Santé Quebec, sort of another new department, but we're out of time. We can cover that next time. Dr. Sabbath, Thank you very much. I appreciate the time.
Thank you, Eric, for the opportunity.
You bet.